The treatment for colorectal cancer is very dependent on the stage at which the cancer is diagnosed. So if a patient is first confirmed to have colorectal cancer, he or she would need to undergo certain tests to stage the cancer. This, aside from colonoscopy for biopsy, the other types of staging tests would include a CT scan or an MRI, depending on the requirement, and some blood tests. Now, patients would then be staged into either stage 1, stage 2, stage 3, or stage 4 colorectal cancer. Now, for patients with stage 1 to stage 3 colorectal cancer, the aim of treatment is still curative, meaning doctors will aim to cure the patient of the cancer. Now, the primary modality for the treatment is surgery. So whatever it is, it has got to involve surgical removal of the segment of the colon or rectum that is harboring the cancer. Upon removal of that segment of colon, in most instances, surgeons will rejoin the colon such that your excretion still goes through the normal passage. Now, after surgery, there may be a role for chemotherapy. Now, chemotherapy involves either taking a tablet or getting injected with the medication. There are currently numerous regimes of chemotherapy available for colorectal cancer, and these are increasingly effective in reducing the chance of the cancer coming back. Now, chemotherapy is very often given after successful completion of surgery. The third modality that is sometimes used is radiotherapy. It's important that patients differentiate between colon cancer and rectal cancer, because radiotherapy is specific mostly for rectal cancer. There's very little role for radiotherapy in colon cancer. So in rectal cancer, radiotherapy has been shown to reduce the chance of the cancer coming back. And it can be given either before the surgical resection or after the surgical resection. So those are the three main modalities for treatment of colorectal cancer. Stage 4 colorectal cancer means that the cancer has spread beyond the colon to other organs in the body. Now, the commonest sites for spread would be the liver and the lungs. There can be spread to bone, the brain, and other sites, but as I said, the commonest sites are the liver and the lung. Now, once you've developed stage 4 colorectal cancer, the treatment then becomes what we call palliative, meaning we are controlling the disease and keeping it at bay. There are instances where treatment can even cause the tumor to shrink. And in instances where patients are very responsive to treatment, some of these lesions may even disappear or melt away. Now, the primary treatment for stage 4 colorectal cancer is chemotherapy. That is the modality that would be most effective in controlling the disease, because the disease is already what we call systemic. It's already in the system of the body. It can deposit in any parts of the body. So surgery becomes less of an issue because you are not targeted at the colon per se. There are still roles for surgery in stage 4 colorectal cancer, but surgery in those instances is used to address the primary tumor. So in other words, if you have stage 4 colorectal cancer and the primary tumor is either bleeding or causing obstruction or going to cause obstruction, then there's a role for surgery to address that so that you can continue to get your chemotherapy. And now chemotherapy over the past 20 years has advanced so dramatically in colorectal cancer that the efficacy or the effectiveness of chemotherapy in controlling the disease is in excess of 50% in some cases. In other words, if a patient has colorectal cancer, that is stage 4, more than half of them would respond to the chemotherapeutic agents that are given. And therefore, they can expect to continue living on so long as the colorectal cancer is controlled. If you talk about surgery, there are always risks. I think the risk of surgery is no different for any type of surgery on any part of the body. Well, the risk of surgery is dependent on several factors. The individual patient, it's very important. If you have a healthy patient, the risks for surgery in this current day and age is, I would say, minimal. There are always risks of infection, risk of complications from the surgery, but in an average risk patient, that is typically less than 5%. Now, the risk of mortality, or meaning risk of dying from the surgery, is also very low in this day and age in a patient who is healthy. Now, of course, if you have a patient who has a lot of other medical conditions, and the commonest would be, of course, diabetes, hypertension, and heart diseases, then the risk is higher than that of an average person. But it is still not prohibitive. And when I say prohibitive, what I'm trying to say is that it's more likely that the patient will do well and survive the surgery than developing complication and succumbing to the surgery. Now, chemotherapy has also its own associated side effects. Now, the risk and side effects of chemotherapy is dependent on the type of agent that is used. And currently for colorectal cancer, there are a host of agents. The commonest side effects would, as usual, be diarrhea. They can get skin peeling from the hands and feet. They can also get a little bit of numbness in the hands and feet. The usual lack of appetite, a little bit of nausea. Those are the common side effects with chemotherapeutic agents used to treat colorectal cancer. The treatment of colorectal cancer has developed by leaps and bounds over the past 2 decades. The main developments can be divided into developments in diagnosis, meaning we have much more accurate means of diagnosing and staging colorectal cancer. By that I mean the newer CT scan machines, the newer MRI machines, and the ultrasound machines. Even the colonoscope nowadays are even better in terms of resolution. You have high definition, and the images are so much clearer, allowing us to pick up polyps at an even earlier stage. Now, the surgical treatment of colorectal cancer has also advanced. 20, 30 years ago, patients needed a big incision in their abdomen just for surgeons to take out the colon. Like many operations today, that is now done with a minimally invasive technique, meaning with multiple small punctures, we are able to take the colon out and do exactly the same operation that has been done all these years. Robotics have come in as well. The robotic platform allows surgeons to perform minimally invasive surgery with improved instrumentation, improving the precision of dissection. Chemotherapeutic agents, like I mentioned before, has absolutely changed the survival in patients diagnosed with colorectal cancer. I think the most dramatic change has been in patients with advanced colorectal cancer. In the old days, patients who have advanced colorectal cancer may not expect to live more than 6 months to a year. In this day and age, with the current treatment modalities that we have, even with stage 4 colorectal cancer, the median survival of patients today is in the range of 2 to 3 years, which is incredible if you think about it. Now, the other important take-home message is that screening has now moved from early detection to prevention. And I believe that it only benefits all individuals to know that this is one cancer that you can actually prevent by picking up the pre-malignant stage, which is the polyp. So if you remove your polyps, the chance of you developing colorectal cancer is almost nil.